presentation, we chose to focus on urinary tract infection, or commonly known as UTI. My name is Brooke, and I will explain the pathophysiology behind urinary tract infections.
My name is Sarah, and I will be describing the clinical manifestations and assessment points.
My name is Alex, and I will be explaining the diagnostic test.
And lastly, my name is Julius, and I'll be covering treatment options. Once we have discussed the details of our topics, we'll cover patient education.
Hi everyone, my name is Brooke, and I'll be covering the pathophysiology of the urinary tract infection. Urinary tract infections are infections anywhere along the urinary pathway. The urinary pathway includes the urethra, ureter, prostate in males, bladder, and the kidneys. When someone is diagnosed with a UTI, that means that a bacteria, fungi, virus, or parasite has entered the urethra. So people with indwelling catheters, patients who are sexually active, pregnant women, or someone who might have poor hygiene habits are at a greater risk for developing a UTI. The most common infection is caused from E. coli bacteria. So when the urethra is contaminated with E. coli, our bodies detect the bacteria and initiate an immune response. The immune response recruits neutrophils to help destroy the bacteria. However, since E. coli is able to colonize and clump together, it makes it hard for the immune system to kill the bacteria before it can spread. If it colonizes and multiplies enough, it can start traveling upwards. So how it travels upward is the bacteria E. coli have pili or finger-like projections, and it binds to the cells, so the uroepithelium cells, and it allows it to go up towards the bladder, the ureters, and the kidneys. Generally, UTIs can be classified as lower UTIs or upper UTIs. So in a lower UTI, if the bacteria is maintained in the urethra, bladder, or in mid-prostate, it is referred to as a lower urinary tract infection. If the bacteria is not stopped or caught in time and it goes unnoticed or undetected by the patient, the bacteria does start to travel like we had discussed in the previous slide. So when it starts to invade the ureters or the kidneys, it then becomes an upper urinary tract infection, which if it's then again not stopped there as well, it can lead to other things like sepsis. Okay everyone, question time to make sure that we were all paying attention. I will give you a few seconds to read the question yourselves, select an answer, and then we will go over it together. Okay, let's review this together. The question is, which option is not a risk factor for developing a UTI? So the question is asking for the option that is not a risk factor. So we know that catheters are one of the main risk factors because they create a direct pathway for bacteria to enter the bladder. We also know pregnancy increases risks due to the increased pressure on the bladder, which prevents patients from fully emptying it when they pee. And also, being sexually active is considered a risk factor because it introduces more bacteria to the urethra. So that leaves proper hygiene as the only option left, and it is the correct answer because proper hygiene is one of the preventing factors and very important to help minimize risks of developing a UTI.
For urinary tract infection, for clinical manifestations, there is upper UTI and lower UTI. In upper UTI, there is pyelonephritis as well as ureteritis. And in lower UTI, there is cystitis and there is urethritis. For upper UTI clinical manifestations, I will be talking about acute pyelonephritis. There are many clinical manifestations for this, but the main ones are back pain or flank pain, high fever, shaking and chills, nausea, vomiting, and dysuria, also known as urgency of urination. In pyelonephritis, it is in the kidneys, compared to the lower UTI, where that is located in the urethra and bladder. In lower urinary tract infections, I will be talking about cystitis and urethritis. In cystitis, the clinical manifestations are dysuria, suprapubic pain, also known as lower abdominal pain, cloudy urine, foul smell after urinating, And in children, we can see a low-grade fever and wetting incidence, as well as irritability and crying. This is located in the bladder for cystitis. In urethritis, we can see urethral discharge, dysuria, pruritus, and burning discharge at the urethral meatus. Urethritis is located in the urethra. My question for clinical manifestations is a 32-year-old woman comes in complaining of dysuria, suprapubic pain, and cloudy urine. She tests positive for a UTI. What kind of UTI does the healthcare provider suspect she has? A. Upper UTI. B. Cystitis UTI. C. Urethritis UTI. D. Pyelonephritis UTI. Or E. Vaginitis UTI. The correct answer is cystitis UTI. The reason why is the main symptoms for cystitis UTI is dysuria, suprapubic pain, and cloudy urine. In upper UTI, that is just a generalization of urethritis and pyelonephritis UTI. And the reason why it is not C, urethritis UTI, is because that is revolving more around the urethral discharge, dysuria, and burning discharge at the urethral meatus. And the reason why it is not pyelonephritis UTI is because that involves more of a side pain compared to a lower abdominal pain. And finally, it's not vaginitis UTI because that involves more of a vaginal discharge and itching and burning sensation.
The final diagnostic test that we'll be talking about is the cystoscopy. How this is used is you insert a camera that goes down into your bladder and urethra. And what this is mainly used for is for patients with recurrent UTIs. It looks to see if there are any bacteria or anything going on with either your urethra or your bladder. Special patient groups diagnostic. For pregnant women, the dipsticks would be insensitive. It is not okay to use the dipsticks to diagnose them, for that to be a diagnostic test. Cultures could mix bacteria, so they would need to use a urine sample. However, you could still have mixed bacteria in there, which could be a false positive. Females with diabetes mellitus, they have very frequent UTIs, and it is a very complicated UTIs because of how resistant the bacteria is. And for men, it is always going to be a complicated situation to diagnose their UTIs. Most likely you would use a urine culture, and the dipsticks is not precise if you use that.
Question: which of the following is not a test used to diagnose a urinary tract infection? A. Urinalysis. B. Urine culture. C. Upper endoscopy. D. Cystoscopy. Time's up. If you chose letter C, you are correct. A urinalysis is a type of UTI diagnostic test which looks for white blood cells and checks for bacteria. B. Urine culture. This is used to determine if any bacteria is present, or if there is bacteria present, what type of bacteria is present in a UTI. D. Cystoscopy. This is used for patients with recurrent UTIs, and it looks at your urethra. And the correct answer, upper endoscopy. This is a procedure doctors look at, where doctors look at your inner lining of your upper digestive tract, which they collect data from.
As far as treatment is concerned, UTIs are usually categorized as either simple or complicated. UTI is one occurring in a normal host who has no structural or functional abnormalities, is not pregnant, or who hasn't undergone any type of instrumental procedure, such as being catheterized. All other UTIs are considered complicated. Risk factors are what qualify a UTI as complicated. Therefore, a complicated UTI is one occurring in a host with predisposing conditions, regardless of the severity of the illness or how the condition presents itself, whether it's lower or upper, such as cystitis or pyelonephritis. The first line of treatment for UTIs is antibiotics. The exact antibiotic that is prescribed usually depends on the exact type of bacteria causing the infection, as well as other considerations such as the patient's history, local patterns of antibiotic resistance, and cost considerations. Typically, simple UTIs would call for a short course of prescribed antibiotics lasting anywhere from 1 day up to a few weeks. So for simple cystitis in men and non-pregnant women, for example, a bacteria-specific antibiotic can be prescribed anywhere from a single dose up to several doses over the course of a week. Some of the antibiotics prescribed for simple cystitis include nitrofurantoin, fosfomycin, and sulfamethoxazole trimethoprim. Second-line option antibiotics that are employed if the primary choices are not a viable option for whatever reason include amoxicillin and certain cephalosporins. Relapsing infections of cystitis within 7 to 10 days require prolonged antibiotic treatment, with follow-up urine cultures taken 1 week after treatment for evaluation, and subsequent urine cultures taken in 3 to 4 month intervals for up to a year after treatment for evaluation as well. For simple upper UTIs like pyelonephritis, quinolones are often prescribed, like ciprofloxacin or levofloxacin. Cases of simple acute pyelonephritis usually receive 2 to 3 weeks of microorganism-specific antibiotics. Though symptoms may wane within a few days of beginning treatment, the entire course of antibiotics may take longer to complete. Healthcare providers may also prescribe a pain medication to help numb the bladder and urethra, thereby relieving any burning sensations often associated with UTIs. For individuals that experience frequent infections, which is defined as 3 or more per year, the following options may be possible. A low-dose antibiotic lasting 6 months or longer. If the infection is found to be linked to sexual activity, a single-dose antibiotic may be prescribed, which is to be taken after engaging in sexual intercourse. And for women that are menopausal, vaginal estrogen therapy may be prescribed. For complicated UTIs, patients may require IV antibiotics to be delivered in a hospital setting. After a short period of IV antibiotics, the remaining antibiotics will revert back to oral administration for up to 2 weeks. As was the case for frequent infections, for complicated UTIs, a urine culture may be taken to show that the UTI is completely gone. Follow-up urine cultures are obtained at 1 week after treatment and 4 weeks after treatment if symptoms occur. Some commonly used drugs as IV therapy include ceftriaxone, which is a cephalosporin, and gentamicin and tobramycin, which are both aminoglycosides. Other antibiotics used to treat complicated pyelonephritis UTIs include Vabomere, which is a combination carbapenem antibiotic and a beta-lactamase inhibitor, Zemdry, which is an aminoglycoside antibacterial, and Avacaz and Zabraxa, which are both combination cephalosporin and beta-lactamase inhibitor antibiotics. Antibiotic-resistant bacteria can occur and tends to be the highest in regions with higher rates of prescription, as well as in those that might have had trimethoprim sulfamethoxazole in the last 3 months, or have diabetes mellitus, or have been recently hospitalized. Specifically, E. coli, Klebsiella, and Proteus, which produce beta-lactamase and carbapenemases, can lead to resistance towards penicillins and cephalosporins. The side effects of medications often include dizziness, gastrointestinal issues such as nausea, vomiting, lack of appetite, stomach pain, and heartburn, diarrhea, since the antibiotics may kill the flora in the gut and lead to an overgrowth of Clostridium difficile, which leads to loose stool. Some of the drugs most associated with diarrhea are amoxicillin, ampicillin, cephalosporins, fluoroquinolones, and azithromycin. Yeast infections are another side effect since antibiotics may cause a change in the vaginal flora that may lead to overgrowth and fungus. Candida albicans is a common type of fungal growth, but usually occurs with mild symptoms. And finally, Stevens-Johnson syndrome and toxic epidermal necrolysis, which is a rare but serious allergic reaction comprised of skin rash, skin peeling, and mucous membrane sores. Drugs that usually cause these reactions include sulfonamides, penicillins, cephalosporins, and fluoroquinolones. Which of the following side effects are common in the antibiotics used in treating UTIs? A. Dizziness. B. Nausea. C. Vomiting. D. Yeast infection. Or E. All of the above? The answer is E. All of the above. Which of the following people would most likely require IV therapy if they developed a UTI? Select all that apply. A. A 25-year-old man with no prior history of UTIs. B. A 55-year-old woman who is very active. C. A 27-year-old woman in her third trimester of pregnancy. D. A 40-year-old man who exercises regularly. Or E. A 30-year-old man who was in the hospital and was catheterized a week ago. The answer is C. A 27-year-old woman in her third trimester of pregnancy. And E. A 30-year-old man who was in the hospital and was catheterized a week ago. Remember that a simple UTI is one occurring in a normal host who has no structural or functional abnormalities, is not pregnant, or hasn't undergone any type of instrumental procedure, such as being catheterized, while a complicated UTI is one that occurs in a person with some sort of predisposing condition. In this case, the 27-year-old pregnant woman and the 30-year-old man that has been catheterized both have predisposed conditions that would qualify them as a complicated UTI. For complicated UTIs, patients may require IV antibiotics to be delivered in a hospital setting. After a short period of IV antibiotics, the remaining antibiotics will revert back to oral administration for up to 2 weeks. As was the case for frequent infections, for complicated UTIs, a urine culture may be taken to show that the UTI is completely gone. Follow-up urine cultures are obtained at 1 week after treatment and 4 weeks after treatment if symptoms occur. Some commonly used drugs as IV therapy include ceftriaxone, which is a cephalosporin, and gentamicin and tobramycin, which are both aminoglycosides. Other antibiotics used to treat complicated pyelonephritis UTIs include Vabomere, which is a combination carbapenem antibiotic and a beta-lactamase inhibitor, Zemdry, which is an aminoglycoside antibacterial, and Avacaz and Zabraxa, which are both combination cephalosporin and beta-lactamase inhibitor antibiotics. Antibiotic-resistant bacteria can occur and tends to be the highest in regions with higher rates of prescription, as well as in those that might have had trimethoprim sulfamethoxazole in the last 3 months, or have diabetes mellitus, or have been recently hospitalized. Specifically, E. coli, Klebsiella, and Proteus, which produce beta-lactamase and carbapenemases, can lead to resistance towards penicillins and cephalosporins.
As nurses, patient education is important so that the patients can fully heal and get back to their lives. We have 8 important key points for patients to follow. The first point being personal hygiene. It is extremely important, since UTIs are from bacteria invading the urethra, that women remember to always wipe front and back after going to the bathroom, and for men and women both to wash genital areas daily.
For the second point, patients should try and avoid wearing tight synthetic underwear. Instead, try wearing loose cotton underwear.
For the third point, patients should make sure to change out of swimsuits and shower as soon as possible with soap and water after swimming in pools or sitting in jacuzzis.
The fourth point is patients should drink water on a daily basis to make sure to prevent dehydration. By doing this, you will dilute the urine and the bacteria will be flushed out of your system before it causes infection.
For the fifth point, patients should urinate after sexual intercourse. This can help flush out any bacteria that may have been introduced.
Another point is while practicing good personal hygiene is very important, certain aspects of it, particularly specific products, might actually be detrimental and contribute to the development of UTIs. You can avoid this by minimizing the use of douches, sprays, and powders in the genital area.
To Shelby's point, bathing in bathtubs can increase your chances of UTI, especially when using bath bombs or bubble baths. So patients should try and take showers as much as possible.
Lastly, you want to avoid holding in urine for too long after you feel the sensation or need to urinate.
From all of us in our group, we would like to say thank you for all your attention and participation in our presentation. If you have any questions, please feel free to let us know. Have a wonderful rest of your day and enjoy your holidays.